Thank you for joining us this afternoon for our first COVID-19 press briefing of the week. Glad that you could be here with us. Today, Orange County Mayor Jerry O. Demings will discuss our goals of the week, some good news regarding the vaccines, and the extension of the county's outreach. Of course, the mayor will discuss our COVID-19 numbers and will also reference the valuable work of our strike teams. And we'll have details on a new initiative to take place next week to combat vaccine hesitancy. Orlando Mayor Buddy Dyer could not be here with us. However, Alvina Chu from the Florida Department of Health in Orange County is here to discuss the details on the vaccination process as well as COVID-19 trending in our area. We begin, as always, with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here this afternoon. We have a busy week planned for us ahead. I want to just share some good news with you. Our first COVID-19 mobile vaccination site that is completely operated by Orange County launched this morning at Barber Park on Gatlin Avenue with great success. 800 appointments were taken in just a matter of time, and another 200 walk-ups are anticipated this evening between the hours of 5 p.m. and 7 p.m. for a total of 1,000 shots that we anticipate to give daily for the next 5 days. The location is right in the heart of the Conway area and is proven to be a very popular location. Again, all online appointments have been taken for the entire week. However, there is still a chance to get vaccinated every evening between the hours of 5 p.m. and 7 p.m. Walk-ups will be offered. We are thankful to the Florida Department of Health and Orange County for their partnership on this initiative and are fortunate to use this opportunity to provide our minority and underserved populations with a convenient location. At Thursday's news conference later this week, we will announce our next mobile site for the following week of April the 19th. For more details, we ask that you go to our website at ocfl.net/vaccine. As we have done for the last year, today is the 125th press briefing regarding our response and recovery efforts associated with COVID-19. So we're going to go over our goals for this week. Number one, we will continue to offer free COVID-19 vaccinations at the Orange County Convention Center and at our various mobile sites. We will continue to offer free COVID testing to any resident who needs it. Of course, we have testing at the Convention Center and at our Barnett Park. And number three, we will continue to make sure county businesses are adhering to CDC standards to keep patrons and employees safe. We plan to announce another appointment opening for the Orange County Convention Center later this week. But in the meantime, we are excited to announce that we have yet another opportunity for our citizens to get vaccinated through our partnership with Advent Health. The Florida Department of Health in Orange County is allocating another 4,600 doses that Advent Health will distribute this Friday, April the 16th, at the pop-up site outside of the Orlando International Airport. The Pfizer brand of vaccine will be distributed at that site, and online appointments are necessary. A sign-up link will be available on Orange County's website at ocfl.net/vaccine. The vaccines at this site are available to those residents 16 years of age and up, but it is important to remember that minors 16 and 17 must have an adult accompany and have a signed consent form. We do thank Advent Health for stepping up to the plate and working with us through this partnership. There are other vaccination sites available throughout the county, including FEMA's hub at Valencia's West Campus. The state told us today that there was no waiting time at this site, and they have lots of inventory for Johnson & Johnson. Again, this is just a single dose, the one and done it shots. The sites operate between 7 a.m. and 7 p.m. 7 days a week, and it is a walk-up site. Again, you can visit our website for information. There are also several pop-up vaccination sites happening this week, including on Thursday at Bravo Supermarkets in the Lake Nona area on Narcoossee Road. will be operating between the hours of 10 a.m. and 5 p.m. and this Friday, April the 16th, at the Bravo Supermarket on North Cimarron Boulevard. In addition, this Saturday, April the 17th, and Sunday, the 18th, there will be vaccinations offered at the Mexican consulate starting at 9 a.m. That is not far away from here on Technology Drive. These are walk-up only, and Johnson & Johnson shots are given at that location. This past weekend, I had the opportunity to visit that site, and I believe approximately 500 people were vaccinated from the surrounding 32804 zip code. Through the end of this month, we will continue to offer free COVID-19 testing at Barnett Park. Orange County Health Services maintains the site 7 days a week between the hours of 9 a.m. to 5 p.m. And although the site had to close at noon yesterday due to the heavy storms, they typically remain open each day between 9 and 5 p.m. Both rapid and antigen testing and PCR testing is offered at that site. We're also excited about the number of people getting one or more doses of the COVID vaccine. Over 50% of Orange County residents ages 40 years and older have received at least one shot. Over a quarter of our entire population, 26.8%, has had at least one shot. While we're excited about the distribution of vaccine, the coronavirus is still very much in Orange County, and we still have to practice appropriate precautions. Since the start of the pandemic, there have been a reported 128,000+ COVID-19 cases within our community. 1,215 residents, unfortunately, have died of the virus. Our 14-day rolling positivity rate is averaging around 7%, which means that it has slowly ticked up within the last few weeks. I want to make an announcement today that we are working with the Department of Health on a plan to phase reducing requirements of wearing facial coverings and social distancing. We are reviewing how CDC requirements are evolving, along with COVID infection data, and a plan will be announced soon. Our business compliance or strike teams were busy over the weekend on the west side of the county. They visited a number of establishments in the West Colonial Drive area and found at least 3 were not in compliance. Since the team started in August, they have conducted 10,265 inspections. Compliance rates are still very high at 99%. Since March the 11th, the teams have visited 871 locations and have issued 35 letters of non-compliance. So I'm proud of our team for going out and working hard each day to ensure that people are complying with the various directives in place. Finally, I hope that all of you can join us on Wednesday morning as we launch a county-wide campaign to combat vaccine hesitancy. We will be sending out more details tomorrow, but this will be a public-private partnership to get our residents vaccinated. And with that, I'm going to turn it over to epidemiologist Alvina Chu with the Department of Health.
Thank you. As the mayor previously mentioned, we've had 128,700 positive cases reported to us as of April 12th today. The current recovery rate, it remains at 96%, and our 14-day rolling percent positivity rate is up slightly to 7.0%. Unfortunately, since we last spoke, we've had 9 additional COVID-19 related deaths reported to us, which brings our totals for deaths to 1,214. Our condolences go out to the families. The age range for these persons were 39 to 97 years old with a median age of 76%. 7 were female, 2 were male, all 9 were white, 4 were Hispanic, and 5 were non-Hispanic. 7 had known underlying health conditions, and 2 had no known underlying health conditions. 8 of the dates of death are from March, and 1 date of death is from April. 4 of the 9, or 44%, were reported from a long-term care facility residential address. So we currently are seeing an increase of cases among the younger segment of our population. So currently, nearly 1 in 10 children ages 5 to 14 years old are testing positive by PCR. The percent positive in this age group continues to increase, indicating that this age group is potentially under-tested. Being that this age group generates many close contacts, it's important that we continue to offer testing for COVID-19 and other respiratory illnesses which still continue to circulate, so the children and parents and their daily contacts know their COVID-19 infection status. Testing in this age group will help us apply the appropriate guidelines to assist lowering the transmission within group settings such as schools and daycares. And so as the end of the school year comes upon us, I know this is traditionally the time when there are a lot of celebrations for a lot of young persons. And so we just want to continue to remind you that as we are optimistically increasing the amount of vaccinations available to everyone 16 and up, with opportunities going into our communities for the underserved populations and under-vaccinated populations, we'd like you to continue to practice the pandemic precautions so that we can get a handle on this pandemic before the variants spread. And so please, in this upcoming season, continue to avoid large gatherings where possible, and if you attend an event such as this, please continue physical distancing where possible. Also continue to wear your mask, watch your distance, and wash your hands. And please stay at home if you are sick. And if you are sick, please try to make an effort to get testing so that you know whether or not your illness is due to COVID-19, so that we can also recommend that your close contacts also stay at home to prevent additional spread of the virus. Our newest cases today, so we've had 4 new cases of variants reported since we last spoke. One was the B.1.1.7 variant, first identified in the United Kingdom. One was the B.1.429 variant, first identified in California. And 2 were the P.1 variant, first identified in travelers from Brazil. The event date for the newly reported B.1.1.7 variant was March 14th. The age range for these new cases were 29 to 55 years of age, with a median age of 38. The total for the age range for all the variant cases is 5 to 84 years, with a median age of 33. Of those cases, all of the variant cases, 72 or 44% had no known travel. And of all of the cases, 1 or less than 1% was known to be hospitalized. And 70 or 42.9% had no known hospitalization. As of April 11th, total doses of vaccine administered in the county are 633,945. And as the mayor mentioned, Orange County residents who are 65 plus with 1 or more doses is a really great 77.1%. And I'd be happy to answer any more detailed questions about the vaccines or the variants. And I will turn it back over to Mayor Demings.
All right, thank you, Ms. Chu. I'm always amazed by our American Sign Language interpreters. They do a fantastic job, especially as Ms. Chu was talking about the numbers associated with the variants. So thank you for what you all do to make sure that our hearing impaired have the opportunity to be communicated with well also. And so we are joined today. We have Commissioner Nicole Wilson with us, Commissioner Myra Uribe, and Commissioner Maribel Gomez-Cordero, who have joined us. They're here for backup to answer the tough questions. We have Mr. Tim Boldig, our compliance team manager and leader. We have also Mr. Scott Howard from Orange County Public Schools, who's here. And so other staff members are here as well to respond to questions. So we'll open it up at this time.
Mayor Lauren Seabrook, Channel 9. You mentioned that you would be announcing a plan soon for ending the mask mandate, but it sounded like you said you would something about reducing The plan would be to reduce masks. Are you looking at something where you'd have phases where certain places you might not have to wear them, or certain people might not have to wear them? Can you tell us a little bit more about that?
Yes, as it relates to the facial covering executive order that remains in place and the requirements for social distancing in compliance with the CDC recommendations, we will be looking at a phased approach to reducing the restrictions associated with that. Those phases will be based upon both the indoor and outdoor capacity of various locations, and so you will see a plan of how we will gradually reduce that within the coming weeks and months.
Amanda Dukes from Channel 2. Elvina, I just wanted a clarification. Did I understand correctly that you said 1 in 10 children under age 15 right now are testing positive?
So of the positives that we have, the largest age group that, if you break down all the positives that we have by age group, the age group that has the highest percent positivity is the 5 to 14 age group, and that's 9.6%.
This is Melissa Thomas with Florida National News. So this question is for Mayor Demings. So I just wanted to follow up in terms of your outreach to those who were shut in, and in terms of that outreach for them to get vaccinated. What are the latest updates with that?
If I understood the question, it is regarding those who may be homebound and what is outreach to them. We will be continuing our homebound program where we will be using our firefighter paramedics to actually go into homes and vaccinate individuals. We are working with the state. The state has a website where individuals can go on and register. We will be working with that list and strategically deploying our resources throughout the county to address that vulnerable population.
Nikki Zizaza with News 6. My question's for Mayor Demings. Mayor Demings, you mentioned that you're going to be making the announcement in terms of the mask mandate that's currently in place. So for months now, so many people have been anxious about when that was going to happen. So at this point, what prompted this? I know you had been saying eventually it was going to happen. What kind of indicators were you guys looking at before you decided you were going to have this decision?
I think there are two primary indicators. One is the rate by which we have vaccinated individuals within our community, and you heard us say that at this point, of those 40 plus years of age or older, 50% of them have been vaccinated at this point. The general population, inclusive of all age groups, we're at over 26%. So we were looking at that number. Number two, we were looking at the infection rate within our community. And so we monitor all of those things. And the last thing that we monitor are the requirements recommended by the Centers for Disease Control. They're evolving. As more research and data has been gathered across the country, what we're seeing is they're making modifications in their recommendations. So with those three things, we will come back with a phased approach that hopefully will make common sense to most people while we're doing things in the manner in which we're doing it.
Steve Hudak from the Orlando Sentinel. This is also for you, Mayor, and it's along those same lines. So we still are seeing the 14-day rolling average creeping up a little bit. The vaccination rate is pretty good. What concerns do you have with lifting some of these protocols and safety concerns, especially since we rely so much on tourism and people come in and feeling safe?
Well, we're going to make our decisions regarding any relaxing of our mandates based upon discussions with the epidemiologists and other healthcare experts here within our community. And as we endeavor to continue opening up our businesses, I believe that our businesses have done a marvelous job of ensuring that they are continuing to comply with the CDC guidelines. Again, through our compliance team efforts, 99% compliance is what we're seeing there. So I believe that that is important as we move forward with the rate of vaccinations going up. The availability of vaccine within our community is ramping up significantly. And we will begin campaigns to deal with vaccine hesitancy and all of those things as we move forward as a community. So I think we try to do things at the right time, and timing would be right. We knew that we would not be in this phase forever where we would be requiring people to needlessly wear facial coverings. So I believe that when we look at those who are perhaps eating in restaurants, there's some modifications I think that can be made there. The CDC has revised its guidelines regarding social distancing. We can make some modifications there. And then with outside types of activities, I believe that we can reduce some of the restrictions regarding limiting capacity of outside venues. Suffice it to say, that does not mean that no one will be requested or required to wear facial coverings. I think that we're still a few months away from that, but it'll be a phased approach as we move towards the summer months. Even though we are seeing a slight uptick in the rate of infection, it's within a narrow demographic. And I think that that particular age group, now that the vaccine will be by the 19th, the president has said that all Americans should have the availability of getting vaccinated. So all of those groups that where we saw a heightened level of infection, as we broaden the availability of the vaccine to other groups, we see the lowering of the numbers occurring. And I believe that I'm not an epidemiologist. That's Ms. Chu's job. But I do read what they send me. I listen to the advice that they give, and we try to make measured decisions in a timely manner.
Mayor, we had one question text in from Ryan Lynch from the Orlando Business Journal, and this is for you. The question reads, how may the area's status as a destination for tourists impact its ability to reduce safety mandates? Will that play a role?
We are the #1 tourist destination in North America, and it's been a living lab for our community. But with the experiment of the NBA bubble and the Major League Soccer and all of those things that were done here in this community, I believe that through those occurrences, we have learned some things from it. And our businesses reopened with a plan of action. Remember, we had an economic recovery task force that was put together with some of the brightest minds, some of the thought leaders in our community, and they came up with recommendations that would allow us to reopen, but to do so safely. Unlike many metropolitan areas around the country, we never saw the danger of exceeding our hospital capacity or any of that within our community. We've been able to manage it over time, even though we have seen spikes at various times, but we are talking about modest spikes in terms of the numbers that we are seeing today, but we now have the vaccine in our community, and that is pivotal as the inventory of vaccine is ramping up quickly. We're seeing different demographics in this multicultural community that we live in who are asking to be vaccinated, and so we want to be able to meet that demand. Okay, that was the last question, so thank you all for joining us today. The next press briefing is planned for this Thursday at 4:30 p.m. Have a great week.